Hey, this is Dr. Allen. Now we're going to talk about body planes and directional terminology for anatomy and physiology. So first we're going to talk about the anatomic position, and then we're going to teach you how to use correct anatomical terms when we're talking about the different body planes. That includes sagittal, coronal, and transverse, and then the various directions, frontal, posterior, superior, inferior, so on and so forth. So let's go ahead and get started. First, the anatomical position. So here's the nice example right here of this person standing like so. The body is erect, standing up. Feet are slightly apart. The palms are facing forward and the thumbs are pointing away from the body. Right? That is the anatomical position right there. So that's the reference point. And when we're talking about these body directions, we're assuming that the person is in the anatomical position, unless stated otherwise. Okay, so what are the body planes? Well, there are three planes, and you can kind of see this three-dimensional thing right here. So you have this median or mid-sagittal plane, right? And that's kind of, you can see where it's bisecting the body from left and right. This is the right side and that's the left side. It's bisected by this median or mid-sagittal plane. And I have this thing right here. Well, what's the difference between mid-sagittal and parasagittal? Well, on a mid-sagittal plane, the it's going right down the center. If it was a parasagittal plane, it would be kind of slicing off to the side, like kind of like maybe over either, maybe the plane is over here to the patient's right. Mid-sagittal is in the middle, parasagittal is kind of off to the side, but it's this separating the body into right and left halves. The next plane we have what's called the frontal or the coronal plane. And you can kind of see three-dimensionally it separates the body from front and back, right? The frontal plane or the coronal plane separates the body from front and back. And this last plane is the transverse plane here, like this, separates the top from the bottom. So we have median or sagittal plane, you have the frontal or coronal plane, and then you have the transverse plane. I'm going to want you to memorize these three different planes. Sometimes it gets a little bit tricky. It's just something you just kind of have to learn. All right, so now that we talked about those different planes, let's talk about different body directions. Now you see here, this is taken from your book, table 1.1 in your book. And so we have two terms here. We have superior and we have inferior, where superior means towards the head and inferior or caudal means tail, superior or cranial, you remember the cranium is the head, caudal means tail. So you have towards the head or upper part of the body, and then inferior or caudal means towards the lower part of the body, going this way. Superior, inferior. Cranial or caudal. So you would say the head is superior to the abdomen. Notice kind of it's relative to each other. The head is superior to the abdomen. The abdomen is superior to the pelvis. In this case, the example here, the navel is inferior to the chin. So the chin is up here, navel's down there. You say the navel is inferior to the chin. Make sense? Next we have proximal and distal. These are very, very, very important terms for you to know. And these are, again, this is kind of relative to something else. So proximal means closer to the origin of the body. I'm sorry, closer to the origin of the body part or the point of attachment of a limb to the body or trunk. What does that mean? Okay, well, proximal means, you can kind of see here, is closer to the origin of the body part, and distal means further away. So you would say here, the elbow is proximal to the wrist, right? Because it's closer to the origin of the arm, which is the shoulder, right? So you would say the fingertips are um, distal to the wrist, right? Because it's going the other direction. The knee is distal to the thigh because it's going away from the origin of the leg, which is, the pelvis right here, right? The foot is distal to the knee. The knee is proximal to the foot. You see how that works? Proximal and distal. Very important terms to get to know. The way that I always remembered it was proximal means, it's in close proximity. It's closer. Distal is more distant or further away. Next we have anterior and posterior, and then we have medial and lateral. So anterior and posterior. So this anterior is towards the front of the body. Posterior is towards the back of the body. The other way of saying that is ventral and dorsal. That's kind of more of a zoological thing. Usually you don't say that. You don't say that too often for human anatomy, but sometimes you do. I think of like a shark with the dorsal fin, right, is on the back of the shark. Posterior. Ventral would be towards the front or the belly. And then medial and lateral. Medial means towards the midline. Lateral means away from the midline. So in this case, you would say the heart is medial to the arm. The arms are lateral to the chest. Right? It depends on the way you're going. Lateral is off to the sides. Medial is towards the midline. And then finally, we have superficial and deep. I think that's fairly intuitive. Superficial means towards the body surface, and deep means away from the body surface. You'd say the skin is superficial to the muscles, right? Because it's on the outside or on the surface. You'd say the lungs are deep to the skin. So that should be pretty straightforward for you there. Okay, that concludes our directional terms. We'll see you for the next one.